Good morning viewers. Today we have the privilege to host Dr. 𝐕𝐢𝐼𝐚𝐲 𝐊𝐿, Director Department of Nephrology and Kidney Transplant. Today we will get to know about kidney biopsy. Good morning sir.
Good morning.
What is kidney biopsy?
See, kidney biopsy is a procedure where we take out a small piece of the kidney, just like a hair thin fragment of the kidney that is taken out, and then we put it under the microscope to understand what is going on inside the kidney. So basically it's a diagnostic test to understand the diseases that is inside the kidney which are not apparently seen on blood test or the urine test.
So when do we need a kidney biopsy?
So kidney biopsy is needed when the patient has got a clinical feature that suggests that something wrong is going in the kidney, but we are not able to understand that on the basis of the blood test or the urine test. Then in such a situation, to understand the pathology of the disease, what is going on inside the kidney, we need to do a biopsy. It can be in an acute kidney injury, like sometimes the patient has got a sudden kidney failure which is not apparently seen, diagnosis is not made on the blood test or the urine test, then we have to do a kidney biopsy. Or somebody has got like hematuria, that means presence of blood in the urine, presence of protein in the urine, or any other reason which is likely leading to a temporary or permanent kidney failure, where we can intervene in the form of doing a biopsy and get to know what is the pathology, and after that we can make a diagnosis and do the adequate treatment or the precise treatment.
How is the biopsy done?
See, biopsy is a very simple procedure. There is a lot of apprehension in the society about the kidney biopsy, but frankly speaking, for the last 20 years in nephrology, it is, from my own experience I can say, that is a very simple diagnostic procedure where the patient is asked to stay in the supine posture. He is supposed to lie on his abdomen, and then we see the kidney through the ultrasound, and after that a small needle is inserted where we do a local anesthesia, and after that local anesthesia we put the biopsy needle inside the kidney. It's a very thin needle that goes inside the kidney, and then it punctures the kidney and take out a small fragment. It's just like a thin, as I said, a hair thin structure of the kidney is taken out. After the biopsy, the patient is basically asked to remain supine for a certain period so that there is no further complication, and we keep the patient under observation for some time.
Is it safe to undergo kidney biopsy?
Yes, definitely. The apprehension that has come forward because of the previous, maybe some complications might have happened in the past, but today, in today's era, I will say that kidney biopsy is very safe. The chances of complication is less than 1%, and most of the time that we see the complications are very minimal.
What are the possible complications for kidney biopsy?
See, kidney biopsy, as I said, is a safe procedure, but there are chances that less than 1% patient may have some kind of bleeding in the urine, which is mostly microscopic. Sometimes it can be gross hematuria or blood in the urine, but mostly controllable. A very small number of patients, maybe less than 0.05% patients, may require some intervention like angio embolization. Sometimes there can be a bleeding around the kidney, which are mostly controlled, but mostly I would say 99% chances are that the complications are so minimal that the most of the procedures are safe, and the patients do not face any major problems post biopsy period.
What are the pre-procedure precautions we take to prevent complication?
For any patient who is likely to undergo a kidney biopsy, first thing that we see that the patient should have a good volume status. That means he should neither be dehydrated nor should be overhydrated, so that there is no problem in lying flat in the bed. Second thing is that there should not be any anticoagulant or a blood thinner that the patient should be taking. We normally stop it at least 3 to 5 days before the procedure. We need to control the blood pressure, and the patient has to be motivated and should be willing to give a consent for the biopsy. So these are some prerequisites that we see when we do a biopsy. At the same time, we also look at the kidney structure through the ultrasound, whether it is biopsiable or not. Only when it is biopsiable we do a biopsy, otherwise we do not. We sometimes see that the patient kidney is very small in size or some other structural abnormality is there. In that case, we normally do not do biopsy. So whenever a biopsy is decided at our center at least, we make sure that the biopsy is successful and it is safe for the patient.
Okay. What post-biopsy precautions we take to prevent any complication?
See, after the biopsy is done, we advise the patient to remain supine for at least 8 hours in the bed. In that period, the patient doesn't move out of the bed. He has to remain supine and he can just move his legs a little bit and his hands. Otherwise, the body remains supine. And we keep monitoring the blood pressure, the pulse and other parameters. We normally keep the patient hydrated and look at the urinary output during those 8 hours or 10 hours of supine posture, and look at the urinary color. If any change in the color happens, which might happen in a small number of patients, we urgently look for the blood test and see if there is any drop in the hemoglobin level. So we take utmost precaution so that the biopsy procedure should be smooth and the post biopsy stay of the patient should remain very safe, so that there is no complications happening. And with that, most of the time we are accomplishing a good kidney biopsy safe procedure, and the patients are discharged after a certain time and they go home very sound and safe.
Thank you viewers for your patient listening.